My name is Denise Burgos, and let's go to talk about an anti-CD3 antibody teclistamab in relatives at risk for type 1 diabetes. Definition: Type 1 diabetes is a chronic autoimmune disease that leads to the destruction of insulin-producing beta cells and dependence on exogenous insulin for survival. Some interventions have delayed the loss of insulin production in patients with type 1 diabetes, but interventions that might affect clinical progression before diagnosis are needed.
Understanding blood sugar, the basics for school staff. Checking blood sugar is one of the most important tasks of managing type 1 diabetes. If you have a student with type 1 diabetes in your classroom, even for part of the day, it's important to learn the basics. Students with type 1 diabetes must check their blood sugar several times a day. This is done either with a glucose meter, which uses a small drop of blood from a finger, or a continuous glucose monitor, a wearable device that measures sugar every few minutes and sends the details to a receiver or smart device. Students should be able to check blood sugar whenever and wherever they need to. Blood sugar levels guide decisions about treatment, such as when and how much insulin to give and when to have a snack. Remember these 4 things about blood sugar. The carbohydrates in food raise blood sugar. Insulin lowers blood sugar. Stress, illness, or excitement can raise blood sugar. Physical activity usually lowers blood sugar. A student's blood sugar level can affect how they feel. For example, high blood sugar, usually above 15, can make it hard to concentrate. Low blood sugar, less than 4, can cause confusion. Low blood sugar must be treated right away with a fast-acting sugar like juice or candy. It's not safe to send a student to a different location or leave them alone if you think their blood sugar is low. If you suspect a low but aren't able to check, treat it anyway. Remember, a blood sugar reading is neither good nor bad. It's information that helps a student and their parents make decisions about diabetes management. Be sure to have a communication system to share a student's daily blood sugar levels with their parents or caregivers. Understanding the highs and lows of blood sugar and knowing when and how to check it can help keep kids with type 1 diabetes safe at school.
Applications in nursing. In type 1, diabetes progresses through asymptomatic stage before the development of overt hyperglycemia. These stages are characterized by the appearance of autoantibodies stage 1 and then dysglycemia stage 2. In stage 2, metabolic response to a glucose load are impaired, but other metabolic index, for example, the level of glucose in the hemoglobin, remain normal and insulin treatment is not needed. These immunologic and metabolic features can identify persons at high risk for development of clinical disease.
About 10% of people with diabetes have type 1. It's got nothing to do with diet or lifestyle, it just happens. When you have type 1 diabetes, your body attacks the insulin-producing cells in your pancreas, so you can't produce any insulin at all. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 1 diabetes, your body still breaks down the carbohydrate from food and drink and turns it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream. So what does this mean? Well, before diagnosis, Your body tries to get rid of the glucose through your kidneys, and that makes you wee a lot. Weeing so much leads to another symptom of diabetes, extreme thirst. Because glucose can't enter your cells to give you energy, you'll feel incredibly tired. To try and get energy, the body breaks down fat stores to provide fuel. That's why people often lose weight before discovering they've got type 1 diabetes. These symptoms tend to come on quickly, over just a few days or weeks. Anyone who has these symptoms should see a doctor as soon as possible. If you've got type 1 diabetes, you get insulin into your body by injecting it, or using a pump which delivers a constant supply into you. You'll also need to check that your blood glucose levels are not too low or too high by using a blood glucose testing device several times a day. When you start taking insulin, you'll begin to feel better, and your blood glucose levels will go down. This is important because over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the long-term effects of diabetes and high glucose levels can be managed. You can find out how we can help you manage your diabetes on our website. We're still not sure why some people get type 1 diabetes and others don't, or why the immune system of someone with type 1 attacks the cells that produce insulin. But our researchers are learning more and more about type 1 diabetes, so we can develop new treatments and one day find a cure.
Pros and cons. Pros. The effects of teplizumab were greatest in the first 3 years after administration. 41% have disease within the first year after randomization, and the risk was lowest at that time for those exposed to teplizumab. Cons. The core was relatively small and the estimate power was limited. The participation relatives of patients with type 1 diabetes. We don't know whether this finding will be generally applicable to persons who do not have first-degree relatives with diabetes and who appear to be at risk for type 1 diabetes.
So I think we've learned in the treatment of acute leukemia that stem cell transplantation is the best possible way to cure leukemia. And we also know that the T cells within the stem cell transplantation are the key effector cells for graft versus leukemia. So I think it's been really exciting that we now have sort of adapter molecules, small antibody constructs that utilize T cells independent of their TCR specificity to leukemic cells. And we've seen in ALL with blinatumomab that we have a new tool to actually treat relapse refractory ALL, and there have been amazing successes in treating MRD positivity in ALL. So we've been interested in utilizing these kind of constructs for the treatment of acute myeloid leukemia. And currently we have a phase 1 trial running in the US and in Europe where we are looking at a CD33 ubiquitously expressed target antigen in AML, utilizing a CD33 T-cell engager for treatment of relapse refractory AML. And clearly the aim of this phase 1 study is safety and feasibility and trying to find the limiting dose. So currently we are recruiting patients and there's no data to clinical efficacy yet.
Ucsg applied in Ecuador. Treatment with a single course of teplizumab delayed the time to diagnosis of type 1 diabetes 19 43% of the 44 participants who received talizumab and 72 of the 32 participants who received placebo have type 1 diabetes diagnosis. In conclusion, in our trial, a 2-week course of treatment with teglizumab delayed the diagnosis of clinical type 1 diabetes in high-risk participants. Thank you.
Type 1 diabetes is a condition in which the pancreas produces little or no insulin. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. While your body is digesting the food, the carbohydrates are broken down into glucose. The glucose is then absorbed into the bloodstream, where it is carried to cells throughout your body. Insulin helps your cells absorb the glucose in your blood, allowing it to be used as energy. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 1 diabetes, the pancreas produces little or no insulin. Without insulin, blood glucose levels rise. Without insulin, glucose cannot enter the cells and be used for energy. As a result, it remains in the bloodstream. As a person with type 1 diabetes, it is important to monitor and maintain healthy blood glucose levels. High blood glucose levels over a long period of time can lead to health complications. If your blood glucose level drops too low, even for a short amount of time, you may feel dizzy or too hot or cold. If your blood glucose level drops extremely low, you may lose consciousness. By taking insulin as prescribed by your doctor and maintaining a healthy diet, you can keep your blood glucose levels within a healthy range.